Welcome. I'm Mike Miller, and I'm with the University of Louisville, Kentucky Autism Training Center, better known as KATC. I graduated from Murray State University with a Bachelor of Science in Elementary and Special Education, a Master of Arts in Special Education, and I got my 30 hours above my Master's in School Administration. I have served as a classroom special education teacher in middle and high school settings and held several administrative positions and was also a director of special education. And I worked at the Kentucky Department of Education, Office of Special Education and Early Learning, which is the name the office is currently known as. I came to the University of Louisville in 2014, and I work with families and caregivers in navigating resources. I'll be using the terms parent and caregiver interchangeably unless otherwise noted. I currently am working with 12 autistic students that are primarily engineering students at the University of Louisville. I want to tell a little bit about our office at the University of Louisville, the Kentucky Autism Training Center. Dr. Larry Taylor is our executive director. Heidi Cooley-Cook is the assistant director. Michelle Bush is a program coordinator senior and is in charge of office operations. Kim Howard, Enid Hurtado, and Heather Alger and Tracy Belfield are our field training coordinators, which work in public schools with our ASD training sites. I want to tell you a little bit about the KAT website, KentuckyAutism.org. It's KYAUTISM.org. And to join our listserv, which gives you information about upcoming trainings or events that may be happening around the state, you can send a message to our office and follow the instructions on the information needed. On our website, you can find more details about professional development trainings, register for public trainings such as our ADOS-2, which is an evaluation tool for diagnosing autism, and parent summits, which are parent trainings that we have across the state, and request Yellow Dot brochures. I want to talk to you a little bit about some of the recent updates that we've done on our website. We've divided it up in three categories, which is information for all ages, children, and adolescents and adults. When we're talking about information for all ages, that's like when you're looking at finding your, if you need to have a diagnosis done, regional university-based multidisciplinary evaluation centers. We have a Kentucky provider list, which is done by the Kentucky Cabinet for Health and Family Services, which we utilize, and community mental health centers, and Kentucky Partnerships for Families and Children. Then our next category is children, where we have the autism provider list that gives you providers for different services, autism disability-friendly child care centers, and things that do when you want to get a diagnosis. And then a third category is adolescents and adults. We have this provider list for services, counselors, and Kentucky employment, because we're looking at that if going through school and then to the adult world. The Centers for Disease Control and Prevention keeps up the data on the prevalence figures. And autism is a lifelong developmental disability resulting from a neurological disorder that affects the brain functioning. It's 1 in 36, not the 1 in 44 that you see on the screen. The data changed after I had completed the slides. Children have been diagnosed with autism in the U.S. So we look at 1 in 36 instead of the 1 in 44. And we have an estimated 2.21% of our adults that have a diagnosis of autism. I want to touch a little bit today on the overview of autism spectrum disorder. It's a triad of characteristics. When we're doing a diagnosis, you're looking at social interaction, communication, restricted, repetitive behaviors. And all these affect your home, the school, and the community. So when we're looking at that triad, if you're really deficit in 2 of the 3 areas, more likely a diagnosis is going to be given. This kind of gives you an an overview of what the diagnosis looks like and what are they evaluating for. And this next slide, if you know one person with autism, you know one person with autism. You've probably heard that before, but it's so true when you're working with an individual because each individual has their own individual behaviors, their own individual styles of learning, And so it's something that you really, when you're working with individuals with autism, you must keep in mind that there's not going to be two students that are going to be just alike. Next, I want to talk to you a little bit about University of Louisville, Kentucky Autism Training Center. We've made a listing of the evidence-based practices. And when you're talking about an evidence-based practice for autism, it's an instructional intervention procedure, and or a set of procedures which researchers have provided an acceptable level of research that shows practice produces positive outcomes for children, youth, and adults with autism spectrum disorder. I want to talk a little bit about statewide supports. The University of Louisville Autism Center, which is now Norton's Children's Autism Center, in March of 2020, Norton's bought the pediatrics from the University of Louisville, but you still can use this website, www.uflautism.org, and it tells you a little bit about what they're doing at their autism center. They do research, they provide services of communication, occupational therapy, psychology services, and they do evaluations. And then they also do training of next practitioners for autism. Then we have the Kentucky Department of Education, which oversees our educational programs in the schools. They are a big support to KATC and its developing trainings and being able to provide services throughout the state. Then we have Kentucky First Steps. This is a program that from birth to age 3, you will be eligible for Kentucky First Steps if you've been identified with a developmental disability. Anyone can do a referral to Kentucky First Steps. It does not have to be just a physician. And so this is something we need to get, because pre-service is where we really make progress with working with children with autism. Then we have the 211, which this is in Pacific regions like Louisville, Lexington, Northern Kentucky, and Bowling Green. I do believe it has spread further into Western Kentucky and in Eastern Kentucky. You can call this line 211. I use it all the time. I need to find an occupational therapist in Morgan County. I will call 211, ask for occupational therapist at 211, and within a few minutes, they come back and give me all the names, addresses, and telephone numbers that I can contact. There's also a new one I do not have here called 988, and that's for mental health and suicide prevention. Office of Autism. This is an Office of One that was created that oversees supports for autism, and Tal Curry is the executive director of that and does an excellent job. Then, of course, we have our overview of online and web-based supports. The CDC Autism Case Training and the CDC Act Early. These are great programs that you can get information that you can disseminate to families. Like a lot of the families that I come in contact with is a child, and they have never had a child before. And so we have like milestones that they can give the information what your child should be doing by 2 months, 3 months. Then we have the National Professional Development Center for Autism Spectrum Disorders. Then the Marcus Center, which is in Atlanta, Georgia, and it is with Emory University. And what they do there is mainly focus on research. And then Ocala, Ohio Center for Autism and Low Incidence, they do all kind of modules, and they also have a great conference. It's in November that provides a lot of information to families and to providers. And then they have the Autism Certification Center also there. Now let's talk about community-based versus school-based services. Special education related services are determined by the school district and the Admissions and Release Committee. They're known as the ARC. The interventions and services must be relevant to the student's academic performance. Students may receive additional outside services. Recommended that if receiving services from multiple individuals, setting that a coordinated effort is made for ongoing communication and collaboration. Outside service providers are not often permitted inside the school to provide intervention services, and the services that are provided inside the school are the district's responsibility, and liability could be a factor. Some school districts may contract with providers if they do not have someone at the district that provides the service as identified in the individual education program, or known as the IEP. One of the key factors from this, I want to look at how that community outside services and the collaboration between the school can be such a good factor to make successful programming for students with autism. Okay, let's talk about overview of frequently recommended interventions. Autistic students sometimes need speech therapy, and then if they have no communication at all, which is non-speaking or non-verbal, they may utilize a augmentative communication device. Usually before you go to those devices, you're working with PECS, which is picture exchange system. So that way, it does show, research shows us that it does increase speech. Occupational therapy, feeding therapy, as students sometimes have very picky eating habits. Physical therapy, counseling, psychiatry, neurology, developmental pediatrician, behavior supports, BCBA for some behavior or mental health professionals, community living supports, first steps, respite care, and case management. And all these are very, very important things to review and see if that's going to be a benefit for your child. Funding mechanisms in the state of Kentucky. Medicaid. What is Medicaid? A Medicaid waiver is a program that provides specialized services to individuals who have Medicaid and meet certain diagnostic criteria. These specialized services are designed to help those individuals to live in the community with as much independence as possible. What waivers do we have in Kentucky? I'm going to go basically over 4 waivers with you today: the Michelle P., Home and Community Based, and Supports for Community Living, and Heart Supported Living Grant. And I'm going to talk about a few others, but those are the 4 we'll focus on. With waivers that we have in Kentucky are Acquired Brain Injury Waiver Acute, Acquired Brain Injury Waiver Long Term, Model 2 Waiver, Home and Community Based Waiver, Michelle P. Waiver, Supports for Community Living Waiver, and then the Heart for Supported Living Waiver. Who's qualified for a waiver? Each waiver has its own eligibility criteria. These are the basics. Acquired Brain Injury Waiver Acute, age 18 or older, have a brain injury and need acute rehabilitation. Acquired Brain Injury Waiver Long Term, there's a wait list for this one, age 18 or older, have a brain injury, need long-term intensive support. And a Model 2 waiver is a ventilator-dependent 12 or more hours a day on an active physician-monitored weaning program. Who qualifies for a waiver? All right, let's go down to the home and community-based waiver. And it is this waiver, it can be for up to age 65 or older and or physically disabled. An example, cerebral palsy, seizure disorder. Then we have the Michelle P. waiver, which is a wait list. Have intellectual or developmental disabilities, an example, Down syndrome, autism. Supports for community living waiver, there is a wait list. Have an intellectual disability, a full-scale IQ of 70 or below, and adaptive of 70 or below. What services do a waiver offer? Services vary by waiver and may include, but not limited to, behavior supports, community living supports, respite, personal care and homemaking, adult daycare health or adult daycare training, residential services, supported employment, and skilled services. How do you apply to get on a wait list for a Medicaid waiver? You can contact your community mental health centers and ask for an on-call person for family support. The person on call will let you know if your community mental health can assist you with completing your waiver application or direct you to another agency provider who can assist you with the application. How do I apply to get on the wait list of a Medicaid waiver? If your child or loved one has a developmental or intellectual disability, a community mental health center case manager will be assigned to your case and will inquire about request the following. Does the client have Medicaid? If not, apply by calling the Department of Community-Based Services, that's DCBS, or call 855-306-8959 or online at kynect.ky.gov. You must apply for Medicaid even if you think you will be denied due to income. How do I apply to get on the wait list for a Medicaid waiver? A copy of a psychological evaluation report that confirms the client's diagnosis. This can be done through a school district integrated assessment report or a reevaluation report. It can also be a report from a private psychologist, such as Norton Developmental, Norton Autism Center, Square One, etc. If applying for the home and community-based waiver, a MAP 10 is required. This form can be found in a Google search for MAP 10. The Heart for Supported Living waiver. This is a waiver that's only given out on April 1st of each year. And it's for your big ticket items, which can be like if you have a child that is a runner, which we call eloping, then you could maybe request a fencing for your backyard. If you have one that breaks like the windows, bit excessive with that, you could get window replacements of a manufacturing material that won't break. For example, I had a family that lost, I think when I worked with them, they lost 18 televisions. So then they had a television inserted in the home to where the child could not get to it with a safety covering glass covering it. These waivers, which you could also use your private insurance or cash payment. Well, those are the cash payment is not what they want us to look at, but we look at your private insurance and see what it will pay. This is a very important aspect for families because it really reduces cost, and we want to make you sure that we can give you the best services for your child with the funding mechanisms that we have to offer in the state. Strategies for collaborating with autistic students for success. There's a list here of different strategies that you can use with students to make their educational system more successful. Some of these are from primary school to all the way to higher education. So some you would use in higher ed, you would not use in preschool. But these are some that you can look at that you can come up with creative ideas in your classroom, like seat assignment. Seat assignment sometimes is very, very important, and it sometimes prevents a behavior. Because I have a student come in that has autism, and they sit in their seat. The next day, they come in, and someone's sitting in the seat they started with the first day, and that they consider that was their seat. So take away that, that seat assignment can be very, very beneficial. Visual schedules are also very beneficial. It's like, what have I got to do today? These are my list of things that have got to be accomplished. They enjoy when they can make a mark through it, and so that there's marks through everything on that schedule. They've accomplished what's on their assignments for the day. One thing you really have to be mindful of is idioms, sarcasm, jokes, tone of voice, facial expressions, body language, and gestures. Because autistic kids don't understand them or don't be mindful of what them. You tell a joke, and they don't understand it. So sometimes the response is going to be, that's stupid. Well, as we get older into our cycle of life, we're getting ready to go to the job market. That's something you can't say to your boss if your boss wants to tell a joke. So one of the things you have to work on, how can you manipulate that situation to where it will be no behavior outcomes that are not inappropriate. And the one thing that's so important is you reinforce appropriate desired behaviors and activities. Crisis intervention. These are some things I want to discuss today. And this slide right here is one that I use with higher education, but it also has some benefits that will help school-age students. Some of the things in here you won't have, like I will talk about, dean of students, or you're going to have a U of L police. Those are things you're not going to have, but I want to talk more about the antecedent-based interventions in place. I would refer to strategies previously discussed. Is there something that's going to prevent a behavior? Conversations with the student to understand what their triggers are, identify precursors, and develop a plan for de-escalation. Identify a point person for students, communicate with building or school personnel as needed, and if the incident does occur, maintain safety of other students, move others from one space if individual will not leave the environment, verbal prompts to a minimum, and then contact your principal, or you contact your dean of students. After the incident de-escalates, review the incident with the student, modify a plan if needed, and have a discussion with classmates as they approach with concerns. These are just good common sense factors of how to work with a crisis that may occur in your school. It has been a pleasure speaking with you today. Please contact me if you have any questions or concerns about things that you may need navigating resources. If I don't know all the answers, but if I don't know, I will research it and find some way to help you. My name is Mike Miller. My email is mrmill15@louisville.edu. That's Mr. Mill15@louisville.edu. And we have a KAT service account email, which is basically, if you don't have my email from you need to send us something, just katc@louisville.edu. And the Kentucky Autism Training Center, we're located at 1405 East Burnett Avenue, Louisville, Kentucky.
Thank you for watching this video. Please take a moment to complete this short feedback form by scanning the QR code or typing the URL into your web browser. Thank you.